complicated in inpatient coding. Okay. So coming to sepsis, okay. Before that sepsis, first you can learn some things in sepsis topic. Okay. First you can learn bacteremia. Okay. So what is the meaning of bacteremia? Okay. So simply means presence of bacteria in the bloodstream. Okay, so generally this is mostly a laboratory finding and usually clear with a person own immune system. Okay, so the bacteremia is resolved without treatment. Okay, so based on patient own immune system. Okay, so the bacteremia means as presence of bacteria in bloodstream. Okay, so that is called bacteremia. Okay, so yeah. Okay. For example, so the patient comes for bacteremia. Okay. So the bacteremia. Okay. So the bacteremia means as presence of bacteria in bloodstream. So the diagnosis code is R78.81. Okay. So the bacteremia, the diagnosis code is R78.81. Okay. So the diagnosis code is R78.81. Okay. For example, the patient comes for fever and so the physician confirmed as bacteremia. The blood culture is positive for MRSA. Okay. So the physician simply documented MRSA bacteremia. Okay. So how to code for MRSA bacteremia? Okay. So go to bacteremia. Okay, so go to bacteremia. Okay, so in bacteremia, so there is no specific combination code for bacteremia along with MRSA. Okay, that time the combination code is not found in the ICD-10 alphabetic index. So that time you can give two separate codes. Okay, so that time the bacteremia code is separate and what is the bacteria presence in the bloodstream. So that time you can give the bacterial infection code is separate. So in this case, the MRSA bacteremia, so that time two codes required. Okay, so the first code is like bacteremia. So the bacteremia code is R78.81. Okay, and you can give additional code for MRSA. Okay, you can give additional code for MRSA. So the MRSA C, you can type here like MRSA. Okay, so MRSA C. In MRSA infection, one code is there. As the cause of disease classified elsewhere, one code is there. Okay, MRSA along with sepsis, one code is there. Okay, so which code we can consider in this example? Okay, so the MRSA bacteremia. Okay, so the MRSA bacteremia, you can give A49.02 or B95.62 or A41.02. Which one is the appropriate in this example? Tell me. Anyone?
B95.62.
What?
B95.62.
Yes, B95.62 is the appropriate. Why this code is appropriate? Any specific reason? Why are you not given like this A49.02? Why are you given this B95.62 in this example?
There
Okay,
is no
only
infection.
MRSA infection is
Not
documented.
infection.
That time you can give this code. But any specific condition or disease due to this MRSA, so that time you can give this code. Okay, the patient present
Yes,
for
sir.
bacteremia. What is the cause of bacteremia means? As so that is the cause of bacteremia is MRSA. So that's the reason we can give B95.62. Okay, so there is no specific combination code available in ICD-10 CM for MRSA bacteremia. Okay, so that's the reason we can give two separate codes. One is bacteremia, next one is MRSA. So I will give one more example. MSSA bacteremia. Okay, MSSA bacteremia. Okay, so even the MSSA bacteremia also there is no specific combination codes. Okay, so go to bacteremia. Okay, so go to bacteremia. So in bacteremia, so there is no specific combination code for MSSA. So that's the reason you can code first the bacteremia R78.81. Okay, so the MRSA full form is methicillin resistant staphylococcal aureus. Okay, so this is one of the gram negative organism. So that is gram negative bacteria. Okay, so MSSA full form is methicillin susceptible staphylococcal aureus. Okay, for example, the MSSA. Okay, please type here MSSA. Okay, so MSSA. Which code is appropriate? A49.01 or B95.61 or A41.01?
B95.
B95.61. Okay, you can give B95.61. Okay, for example, E. coli bacteremia. Okay, so the patient comes for bacteremia, the blood culture is positive for E. coli. So that time you can consider as E. coli bacteremia. Okay. So the E. coli bacteremia also you can code first the bacteremia code R78.81. Okay. And you can give additional code for E. coli. Okay. So that is Escherichia coli. E. coli means Escherichia coli. You can give ESCHERIA. Okay. Escherichia coli. Okay, as cause of disease classified elsewhere. The code is B96.20. Okay, so in brackets, E. coli also. Okay, E. coli full form is Escherichia coli. Okay, so this is one of the gram negative bacteria. This one also. Okay, B96.20. Yeah, understand, guys? So the bacteremia full form is as presence of bacteria in bloodstream, that is called bacteremia. Okay, so any specific bacterial agent, okay, so growing in the blood culture, so the physician confirmed the blood culture is positive for some specific organism, so that time you can by default consider as the specific organism is related to bacteremia. Okay, so the bacteremia due to MRSA, so that time two codes required. The even the MSSA bacteremia also two codes required, and E. coli bacteremia also two codes required. Okay, so only simply unspecified bacteremia one code is enough. Okay, but any specific bacteria is present in the bloodstream, so that time you can give additional code for the specific bacterial infection as cause of disease classified elsewhere. Okay. Understand, guys? Bacteremia.
Yes, okay.
Okay. So the next one. Septicemia. Okay. So the septicemia refers to the bacteria in the bloodstream that is causing an infection, pathogens such as bacteria, fungus, virus, or other microorganisms. Simply, the septicemia means as presence of pathological microorganisms in bloodstream. Okay. So the pathological microorganism, either bacteria or fungus or protozoa or virus or any other specific organism also. Okay, so that is called septicemia. Okay, but in ICD-10 CM, the septicemia code directly leads to sepsis. Okay, so septicemia. Okay, septicemia. Okay, septicemia meaning sepsis. C sepsis. Okay, so that time the sepsis code. Okay, so the sepsis. Sorry. So the sepsis code is A41.9. Okay, so the septicemia and sepsis both are same. Okay, so the septicemia means as presence of pathological microorganism in bloodstream. Okay, so the septicemia leads to sepsis. Okay, so the code is same code, both sepsis and septicemia same code. The code is A41.9. Okay. Next, sepsis. Okay. What is the definition for sepsis? Means SIRS due to any localized infection. Okay, I will tell you what is SIRS. Okay, so one specific another side is there. Okay, so the time I will tell you in what is SIRS. Okay, so what is the diagnosis code for SIRS? Okay, SIRS due to any localized infection. Okay, what is mean by localized infection? Okay, so the localized infection means the infection is attack only one specific body part. ఓకే సో ఒక స్పెసిఫిక్ బాడీ పార్ట్ లో మాత్రమే ఇన్ఫెక్షన్ వచ్చింది అంటే సో దట్ టైప్ ఆఫ్ ఇన్ఫెక్షన్ ఈస్ కాల్డ్ యాజ్ లోకలైజ్డ్ ఇన్ఫెక్షన్. ఓకే 1 second, yes, 1 second. హలో, యా పాపరెడ్డి చెప్పు. డైలీ ఈవినింగ్ 7:30 to 8:30 అండి. నేను లింక్ షేర్ చేస్తాను, వాళ్ళ బిల్లింగ్ ఉంటే జాయిన్ అవ్వమని చెప్తాను. యా ఉంది ఉంది, నేను పంపిస్తాను. ఓకే. Okay, sorry. Yeah, so the sepsis, okay. SIRS due to any localized infection that leads to sepsis. Okay, so the localized infection means so the infection is attack in one specific body area or body part. Okay, like pneumonia. So the pneumonia is lung infection. So the UTI means urinary tract infection. Okay, so the urinary tract infection, so mainly like bladder or kidney or some urinary organs. Okay, so cellulitis, so most of the times the cellulitis is developed in skin level. Okay, so and abscess also, abscess. Okay, cellulitis and abscess both are common skin infections. And osteomyelitis, so that is bone infection. Okay, and peritonitis, so that is inflammation of peritoneum. So and influenza, so these are all localized infections. Okay, so the sepsis full form. Okay, so the sepsis definition is SIRS due to any localized infection leads to sepsis. Okay, so at the time of sepsis, okay, so the common symptoms, what are the common symptoms for sepsis? Means fever, leukocytosis. Okay, so leukocytosis means elevated white blood cell. Okay, leukocytosis, fever, altered mental status, altered level of consciousness, headache, dizziness, nausea, vomiting, syncope, tachycardia, hypotension, next tachypnea, shortness of breath. Okay, like so these are all the common symptoms for sepsis. Okay, so when you code sepsis, so do not code these symptoms along with definitive diagnosis. Okay, along with sepsis. Okay, so and the sepsis sequencing and the sepsis guidelines are very, very important. Okay, so the sepsis, okay, the source of sepsis is due to any localized infection. That time you can give the sepsis as the principal diagnosis and the localized infection as the secondary diagnosis. Okay, for example, okay, so the sepsis due to pneumonia. Okay, sepsis due to pneumonia. Okay, so the sepsis due to pneumonia. Okay, so in this scenario, you can give the sepsis as the principal diagnosis. Okay, A41.9 as the principal diagnosis, and the pneumonia, that is localized infection. Okay, the localized infection J18.9, basically the pneumonia code. Okay, so I will show you how to lead the diagnosis code for pneumonia. Okay, so pneumonia. So the code is J18.9. Okay, so sepsis due to pneumonia, that time you can give the sepsis as the principal diagnosis and the pneumonia is the secondary diagnosis. Because why we are assigned the pneumonia is the secondary diagnosis means sepsis due to any localized infection. So that time you can give the sepsis as the principal diagnosis and the localized infection as the secondary diagnosis. Okay, at the time of sepsis, you can check blood culture results. Okay, at the time of coding for sepsis, you can check for blood culture results. The blood culture is positive for any specific organism. So that time you can consider by default. So the specific organism is related to sepsis. Okay. For example, the patient, for example, a 25 years female patient. Okay. So a 25 years female patient. A 25 years female patient admitted for fever, AMS, altered mental status. Okay, so a 25 years female patient admitted for fever, altered mental status, leukocytosis, tachycardia, SOB. Okay, SOB, and found to have sepsis secondary to acute osteomyelitis of right foot and ankle. Okay, acute osteomyelitis of right foot and ankle. So the blood culture is positive for MRSA. Okay, so the blood culture is positive for MRSA. Okay, so in this scenario, first, what is the principal diagnosis?
A41.
Sepsis due to
So
MRSA.
initially, the patient
Sepsis due to
admitted for
MRSA.
fever, altered mental status, leukocytosis, tachycardia, shortness of breath, and found to have sepsis. So the sepsis is because of acute osteomyelitis of right foot and ankle. So the sepsis is blood infection. Okay, so mainly the sepsis is blood infection. Okay, so what is the so any organism is positive in the blood culture means in this example, so the blood culture is positive for MRSA. Okay, so in this scenario, you can code directly MRSA sepsis. Okay, without physician documentation. Okay, so the physician is not documented like MRSA sepsis. See, the physician simply documented sepsis. Okay, but the blood culture is positive for any specific bacteria. So that time you can code directly by default combination. Okay, so in this case, you can code directly MRSA sepsis. Okay, so I will show you how to code that MRSA sepsis. Okay. Yeah. Add diagnosis. Okay, sepsis. Okay, sepsis. So the option is 1. Okay, so the option sepsis. Okay, next, the sepsis is due to organism. Okay, so the sepsis is due to organism. Why we are considered as organism means the blood culture is positive for MRSA. So that's the reason we can consider as sepsis due to organism. So the option 8. Okay, so the organism is MRSA. Okay, MRSA means methicillin resistant Staphylococcus aureus. Okay, so go to M series. Okay, M series is there? No. So go continue list. Okay, so MRSA. Okay, so the MRSA, yes, we can consider. So the option is 7. Okay, next. So they are asking sepsis due to methicillin resistant Staphylococcus aureus with any carrier or colonization state or toxic shock syndrome. So no. So there is no documentation for carrier or colonization state or toxic shock syndrome. Okay, so do not wish to quote. Okay, so next sepsis. Okay, so the sepsis with MRSA, we already given combination. Next, do not wish to code. Associated any drug resistance? No. Okay, so they are asking wish to code localized infection, spell localized infection. Yes. What is that localized infection? Okay, so that is osteomyelitis.
Osteomyelitis.
Okay, osteomyelitis. Okay, osteomyelitis. Okay, so that is acute. Okay, so the osteomyelitis acute. In this example, I clearly mentioned acute osteomyelitis. Okay, so osteomyelitis acute. Okay, other are unspecified. So that is ankle and foot, right foot and ankle. So I considered ankle. Okay, so other are unspecified. So that is laterality is right. Okay, so do not wish to quote. Okay, no severe sepsis. Okay, no severe sepsis and no procedure. Okay, see the first code is A41.02 sepsis due to MRSA. Okay, and additional code for the specific localized infection, that is acute osteomyelitis of right ankle and foot. Okay, so in this example also I mentioned right foot and ankle. Okay, so that's the reason the foot and ankle the same code M86.171. Okay, first you can code sepsis and additional code for the localized infection, because as per guideline, okay, as per coding guideline, so the source of sepsis is due to any localized infection, the sepsis as the principal diagnosis and the localized infection as the secondary diagnosis. Okay, clear? Advaindandi?
Yes, sir. Yes, sir.
Yes, sir.
A41.02, and so the A41.02 is MRSA sepsis. Okay, so the A41.02 is MRSA sepsis. Okay, and additional code for acute osteomyelitis of right foot and ankle. So the code is M86.171. Okay, so M86.171. Okay, so that is acute osteomyelitis of right foot and ankle. So any doubts on this example?
No, sir.
Okay, so I will give one more example. Okay, so the patient admitted for fever, hypotension, found to have sepsis secondary to UTI. Okay, so the blood culture is positive for E. coli. Okay, so the blood culture is positive for E. coli. How to code this scenario? Which type of sepsis you can consider as PDX?
E. coli. Sepsis E. coli.
E. coli sepsis.
Sepsis
Yes.
with E. coli.
Okay. So the E. coli sepsis as the PDX. Okay. So in previous example, the fever, AMS, leukocytosis, tachycardia, SOB, these are all the symptoms. So that's the reason we do not code symptoms along with sepsis. Okay, because these are all the symptoms for sepsis. Okay, as per signs and symptoms, so the symptoms are the integral part of definitive diagnosis. We do not code symptoms separately. Okay, next. So in this example, we can code first E. coli sepsis. Okay, so E. coli sepsis and diagnosis like, so sepsis. Okay, sepsis due to organism. Okay, so due to organism E. coli. Okay, E. coli means Escherichia coli. So the option is B. Okay, so next, do not wish to code. Drug resistance, no. So spell localized infection, option 1. So the localized infection is UTI. Okay, so the option is 1. Okay, so the UTI, so the specific site of urinary tract infection is not documented. So that's the reason we can consider as other are unspecified. So next, other are unspecified. No severe sepsis, no procedure. Okay, so these are the codes. Okay, so the sepsis due to E. coli, the combination code is A41.51. A41.51, and so that is E. coli sepsis. Okay, A41.51 is E. coli sepsis. Okay, and additional code for N39.0, so that is UTI. Okay, I will give one more example. Okay, so in same example, just now I changed something. So the patient admitted for fever, hypertension, found to have sepsis secondary to right knee cellulitis. Right knee cellulitis. The wound culture. The wound culture is positive for MRSA. Okay, so the wound culture is positive for MRSA. Okay, so can you consider as MRSA sepsis in this example? Can you consider MRSA sepsis in this example?
Yes, sir.
Yes or no?
Yes, sir. Yes, sir. Yes, sir.
No. Okay, we do not consider as MRSA sepsis in this example. Why we do not consider means the sepsis is blood infection, not wound infection. Okay, so the wound culture, this is the wound. The cellulitis is one of the wound. Okay, so the cellulitis. Okay, so the cellulitis is because of this MRSA. Okay, not sepsis. Okay, so that's the reason we do not consider MRSA sepsis in this example. Okay, so the sepsis is blood infection. So that's the reason you can check blood culture results at the time of sepsis coding. Okay, so do not consider urine culture results. Do not consider as wound culture results. Okay, you can consider as only for blood culture results. Okay, so the patient admitted for fever, hypotension, and found to have sepsis secondary to right knee cellulitis. So that time you can give the sepsis as the principal diagnosis. Okay, so that is unspecified sepsis. Go to sepsis, like for example. Okay, so sepsis. So the option is 1. Okay, so unspecified. Okay, so do not wish to quote. Spell localized infection. Okay, so the localized infection is cellulitis. Okay, so the option is 3. So the cellulitis site is spell other specified site, knee area. Okay, so the option 1. So that is right knee or left knee. So that is right knee. Okay, so you can select the option 2. Next, do not wish to quote. More cellulitis size to code, no additional cellulitis. Okay, no severe sepsis. Okay, and no procedures. Okay, so and you can give additional code for MRSA separately. Okay, so at the time of bacteremia, we are given MRSA code B95.62, right? So in this example, you can assign B95.62 MRSA code separate. Okay, so the cellulitis due to MRSA, there is no specific combination code. So that's the reason the cellulitis code is separate and MRSA code is separate. Okay, first you can give the sepsis code A41.9. Okay, so and you can give the localized infection right knee cellulitis. Right knee cellulitis. Okay, so the diagnosis code is L03.115, L03.115. Okay, and you can give additional code for MRSA B95.61 or B95.62. Okay, B95.62. Okay, so any questions?
సార్ ఇక్కడ బ్లడ్ కల్చర్ కూడా ఉంటే అది కన్సిడర్
ఫర్ ఎగ్జాంపుల్ ఇక్కడ బ్లడ్ కల్చర్ లో కూడా ఫర్ ఎగ్జాంపుల్ MRSA పాజిటివ్ ఉంది అనుకోండి ఫర్ ఎగ్జాంపుల్. ఓకే, సో ఇన్ ద సేమ్ ఎగ్జాంపుల్, సో ద wound culture and blood culture, okay, and blood culture is also positive for MRSA. మీ క్వశ్చన్ ఇదేనా? ఇలా ఉంటే
అవును.
ఎలా కోడ్ చేయాలి అనేది మీ క్వశ్చన్, రైట్?
అవును.
Okay. For example, so in this scenario, that time you can consider as MRSA sepsis. Okay, so the MRSA sepsis code is A41.02. Okay, A41.02. Do not assign unspecified MRSA along with more specified MRSA infection. Okay, so that time do not assign B95.62 separately along with A41.02. Okay, so the A41.02 is MRSA sepsis. So this is more specified. Okay, but this is unspecified MRSA. So when more specified and unspecified, both conditions are documented in same widget. So that time you can consider as more specific type of code. Okay, do not consider as unspecified. Okay, so in this example, so please remove this. Okay, so code these conditions only. క్లియరా? అర్థమైందా మీకు ఇది?
అర్థమైంది సార్. ఓన్లీ బ్లడ్ కల్చర్ అయ్యాలి కదా, బౌండ్ కల్చర్ మెన్షన్ చేసిన.
yes. So
యాక్చువల్గా ఊన్ కల్చర్ ఎగ్జాంపుల్ చాలా పర్ఫెక్ట్ ఉంది. ఏంటంటే జస్ట్ కన్ఫర్మేషన్ కోసం అడిగాను.
1 సెకండ్ అండి, మీ వాయిస్ నాకు సరిగా వినిపించట్లేదు. యా, ఇప్పుడు చెప్పండి. వూండ్ కల్చర్
ఏం లేదు సార్, ఊన్ కల్చర్దే పర్ఫెక్ట్ గా ఉంది సార్ ఎగ్జాంపుల్. జస్ట్ కన్ఫర్మేషన్ కోసం అడిగాను అంతే.
ఓకే ఓకే ఫైన్. సో
సార్ వూండ్ కల్చర్ తోటి ఇంకా ఎగ్జాంపుల్ ఏంటి సార్? నార్మల్ గా అంటే బ్లడ్ కల్చర్ తోటి మనము ప్రిన్సిపల్ ఇవ్వమని చెప్పారు కదా, అలాగే వూండ్ కల్చర్ కాకుండా ఇంకా వేరే
వూండ్ కల్చర్ తో ఒక ఎగ్జాంపుల్ చెప్పాను మీకు. అదే ఎగ్జాంపుల్ ని మోడిఫికేషన్ చేశాను నేను ఇక్కడ, రైట్? ఫస్ట్ వూండ్ కల్చర్ లో MRSA ఉంటే ఎలా కోడ్ చేయాలి అనేది కదా మీకు చెప్పాను. అప్పుడు అన్స్పెసిఫైడ్ సెప్సిస్ సెపరేట్ గా, సెల్యులైటిస్ కోడ్ సెపరేట్ గా, అన్స్పెసిఫైడ్ MRSA కోడ్ సెపరేట్ గా కోడ్ చేశాను.
సార్ ఓకే సార్.
ఓకే
ఓకే సార్.
నెక్స్ట్ వన్ మోర్ ఎగ్జాంపుల్.
ఒకవేళ సార్ డిఫరెంట్ ఆర్గానిజమ్స్ వస్తే గనక అప్పుడు అవి కాంబినేషన్
separate codes ఇవ్వచ్చు. For example, the blood culture is positive for MRSA and E. coli. So that time you can give the MRSA sepsis separate code and E. coli sepsis separate code.
ఒకవేళ వూండ్ కల్చర్ కి బ్లడ్ కల్చర్ కి డిఫరెంట్ వచ్చినా సెపరేట్ కదా.
బ్లడ్ కల్చర్ వూండ్ కల్చర్ ని ఇంకా అక్కడ కన్సిడర్ చేయకూడదని చెప్పాను కదా నేను ఇక్కడ. అంటే ఇప్పుడు ఫర్ ఎగ్జాంపుల్ ఇన్ దిస్ ఎగ్జాంపుల్ ద బ్లడ్ కల్చర్ ఈజ్ పాజిటివ్ ఫర్ MRSA, ద వూండ్ కల్చర్ ఈజ్ పాజిటివ్ ఫర్ E. coli. So that time you can give the E. coli code is separate. Okay, the same organism is growing in both. Okay, so the same organism is positive for both wound culture and blood culture. So that time you can consider only blood culture results. Do not consider as wound culture.
Okay.
Okay, so the patient admitted for fever, cold, cough, tachycardia. Okay, so tachycardia and found to have sepsis secondary to pneumonia. Okay, so the sputum culture positive for MRSA. Okay, so the patient admitted for fever, cold, cough, tachycardia and found to have sepsis secondary to pneumonia. So the sputum culture is positive for MRSA. Okay, so how to code this?
A41.9 and pneumonia with
yes, A41.9 sepsis. Okay, and the pneumonia J18.9 and MRSA code. Okay, yes, what is the MRSA code? B96.52. Yes, B96, B95.62. B95.62. Okay, MRSA.
సార్ కాంబో రావట్లేదు సార్ నిమోనియా విత్ ఎంఆర్ఎస్ఏ.
ఏంటండి?
నిమోనియా విత్ డ్యూ టు ఎంఆర్ఎస్ఏ కాంబో కోడ్ రావట్లేదు సార్.
ఉంది, కానీ మనం అలా ఇవ్వకూడదు. ఓకే, సో ఫిజిషియన్ మనకి ఈ బ్లడ్ కల్చర్ లో ఉన్న ఆర్గానిజం యాజ్ పర్ గైడ్ లైన్, ఓకే, యాజ్ పర్ కోడింగ్ గైడ్ లైన్, when the time of sepsis coding, so the blood culture is positive for any specific organism, the physician is not related that organism is due to sepsis. Even also you can consider by default combination, but in pneumonia cases, so the patient admitted for pneumonia, the sputum culture is positive for any specific organism, so that time the physician must and should document it for, so the specific organism is related to pneumonia. Okay, otherwise you should raise a query. Okay, so the patient admitted for so and so condition and found to have pneumonia, the sputum culture is positive for MRSA, so the documentation does not document it, the the pneumonia is due to MRSA. Can you confirm? So this is MRSA pneumonia or unspecified pneumonia? Okay, that is also one of the interview pattern question. Okay, so when you raise a query for specific organism, okay, when you raise a query for specific organism, so that time in pneumonia chance. Okay, so the patient admitted for pneumonia, so the sputum culture is positive for any specific organism, so that time you should raise a query. Okay, so by default you do not consider as, so the organism is related to pneumonia other than physician documentation. The physician must and should document it for the condition is due to pneumonia. Yeah, tell me.
సార్ ఈ సినారియోలో క్యూరీ పెట్టొచ్చా సార్?
ఈ సినారియోలో క్వరీ పెట్టాల్సిన అవసరం లేదండి, ఎందుకంటే ఇక్కడ మీకు ఫర్దర్ గా తెలుస్తుంది. మీకు చెప్తాను ఎప్పుడు క్వరీ పెట్టాలి, ఎప్పుడు క్వరీ ప్లేస్ చేయకూడదు అనేది, అది పెద్ద కాన్సెప్ట్ మనకి ఇన్పేషెంట్ కోడింగ్ లో. ఓకే, సో ముందు చెప్తాను. జస్ట్ ఇప్పుడు బేసిక్ ఫండమెంటల్స్ వరకు నేర్చుకోండి. ఓకే, next, so generally anyone can develop sepsis, but it's most common and most dangerous in older adults or those with weakened immune system. Okay, ఈ sepsis అనేది, so the sepsis can develop anyone. Okay, so anyone means, so that is regardless of age. Okay, old age లో ఉన్న రావచ్చు, అప్పుడే పుట్టిన బేబీకి రావచ్చు, ప్రెగ్నెంట్ పేషెంట్ కి రావచ్చు, ఎవరికైనా. Okay, so the sepsis is developed anyone, but most of the times in older adults. Okay, because their weakened system is very weak, so that's the reason so the sepsis is easily attacked for this older adults patient. Okay, early treatment for sepsis usually with antibiotics. Okay, so that any infection condition, basically the physician provided for antibiotic treatment. Okay, usually with antibiotic and large amount of IV fluids. Okay, intravenous fluids kuda istaru. Okay, improve chances for survival. Okay, sepsis can occur with viral, bacterial or fungal infection. Okay, sepsis may be developed by viral or bacterial or fungus. Okay, sepsis అనేది దేని వల్ల అయినా రావచ్చు, వైరస్ వల్ల రావచ్చు, బ్యాక్టీరియా వల్ల రావచ్చు, ఫంగస్ వల్ల రావచ్చు. Okay, so the most common infections that can lead to sepsis including pneumonia, influenza, UTI, cellulitis, meningitis, gallbladder and abdominal infections like peritonitis and osteomyelitis. So these are all the common localized infection source for sepsis. Okay, so in inpatient, okay, so the physician documented for sepsis, that time you can check for the clinical indicators for sepsis. Okay, what are the clinical indicators for sepsis? So this is very, very important. Okay, so this is very, very important interview pattern question. What are the clinical indicators for sepsis? Okay, so the physician simply documented sepsis, so that time by default you cannot you do not code for sepsis directly. Okay, so that time you can check for clinical indicators. What are the clinical indicators for sepsis? I will show you. What are the clinical indicators for sepsis means? Really, that slide. It is not added here. I think maybe the slide is missing here. So, okay, no problem. I will show you. So what are the common clinical indicators for sepsis? Okay, when there is a localized infection. Okay, so the localized infection is one of the major source for sepsis. Okay, so at the time of localized infection, we check these below mentioned indicators. Okay, what are the indicators means the body temperature 101 Fahrenheit or 36 degrees Celsius. Okay, so the temperature like that is fever. Okay, so fever అనేది 101 Fahrenheit or 36 degrees Celsius ఉండాలి. లేదంటే tachypnea. Tachypnea means increasing respiration. So that level also more than 20 breaths per minute. Okay, and tachycardia increased heartbeat more than 90 beats per minute. Okay, and positive blood culture results and PCO2 value less than 32 mmHg and leukocytosis, that is increased WBC count greater than 12,000 mm or less than 4,000 mm, and shock, that is organ dysfunction. Okay, so these are the common clinical indicators for sepsis. Okay, so at the time of inpatient coding for sepsis, okay, you can check for these indicators. At least you can meet at least 2 indicators. Okay, so that time only you can code sepsis. Okay, for example, simply, so the patient, the physician documented sepsis, but the temperature is less than 100 and the respiratory rate also that is normal, and the heartbeat also normal, leukocytosis count also normal. So that time you do not consider as sepsis. Okay, so that is the difference between inpatient versus outpatient coding, guys. Okay, understand? So in outpatient coding, the final impression sepsis is documented. Blindly you can code for sepsis, but in inpatient coding, you can must and should check for these clinical indicators. Okay, so that time you can check for body temperature, so and heartbeat and respiratory rate and WBC count and PCO2. Okay, so these are all the factors for, these are all the clinical indicators for sepsis. Okay, at least 2 indicators meeting, so that time you can assign sepsis score. Okay, sometimes the indicators are meeting for sepsis, but the physician is not documented for sepsis. So that time also you can check for physician. So that time you can should raise a query for physician. Okay, so that time you can raise establishment query. Okay, so the patient admitted for so and so condition, for example, the patient admitted for pneumonia. Okay, so the clinical indicators like the temperature is 103. Okay, for example, and the heart rate is more than 20 beats per minute. So that is like tachycardia. Okay, sorry, heartbeat means yes, tachycardia and bradycardia, and the blood culture is also positive. Okay, so please confirm whether the patient has sepsis or not. Okay, so that is also one of the query. Okay, so the indicators is meeting, but the physician is not documented for sepsis. So that time also you should raise a query. Okay, tomorrow I will show you the one sepsis account. Okay, so where did you mention the clinical indicators in sepsis? Okay, guys.
Okay.
Next.
Okay, sir.
So the next one is severe sepsis. What is mean by severe sepsis means sepsis with acute organ failure or acute organ dysfunction that can lead to severe sepsis. Okay, what is the definition for severe sepsis means? Sepsis with acute organ failure or acute organ dysfunction. Okay, so that is called severe sepsis. When the physician documented severe sepsis, by default, 2 codes required for severe sepsis. Okay, so the physician documented severe sepsis. So that time by default, we can code 2 codes. Okay, so for example, in sepsis, okay, sepsis severe. Okay, severe. So the diagnosis code is R65.20. In that R65.20 code first underlying infection such as like sepsis, for example. Okay, so the sepsis. So the code is A41.9 and additional code for R65.20. Okay, so the physician documented severe sepsis. Okay. The physician documented severe sepsis. By default, 2 codes required. So when the severe sepsis is documented, first you can code sepsis. So the sepsis code is A41.9 and the second code is severe sepsis R65.20. Okay, the second code is severe sepsis. So the severe sepsis code is R65.20. Okay, for example, so the patient admitted for sepsis. Okay, so the patient admitted for sepsis, okay, and sepsis. So the patient admitted for, the patient admitted for acute hypoxic and so the patient admitted for acute hypoxic and hypercapnic respiratory failure secondary to sepsis. Okay, so the patient admitted for acute hypoxic and hypercapnic respiratory failure secondary to sepsis. Okay, so can you consider as severe sepsis?
Yes, sir.
Yes, sir.
Okay, so the patient admitted for acute hypoxic and hypercapnic respiratory failure secondary to sepsis. Okay, so can you consider as severe sepsis? What is the definition for severe sepsis?
Sepsis with
Sepsis.
acute organ failure.
Sepsis with acute organ
with
dysfunction.
acute organ failure or sepsis with acute organ dysfunction. That is called severe sepsis. In this case, so the patient admitted for acute organ failure. So the acute organ failure is due to sepsis. So that's the reason we can consider as severe sepsis. So the severe sepsis by default 2 codes required. So the first code A41.9. So the second code R65.20. And you can give additional code for
J96.01 and J96.02.
sepsis A41.9. Okay. So, and the severe sepsis R65.20, and you can give additional code for the specific acute organ failure or acute organ dysfunction. In severe sepsis, there is one guideline. Use additional code to identify any specific acute organ dysfunction, such as acute kidney failure, acute respiratory failure, critical illness myopathy, critical illness polyneuropathy, disseminated intravascular coagulopathy. So one of the interviewer asking like this abbreviation, what is mean by DIC? Okay, what is mean by DIC? Okay, so the DIC means disseminated intravascular coagulopathy. Okay, and encephalopathy. So, and hepatic failure. Hepatic failure means liver failure. Okay. So, any acute organ failure along with sepsis, you can code as severe sepsis. At the time of severe sepsis, first you can code for sepsis and you can give severe sepsis R65.20 and you can give additional code for the specific acute organ failure. Okay. So, in this case, so there is documented acute hypoxic and hypercapnic respiratory failure. So in this, failure is the main term. Okay, so the failure is the main term. Respiration or respiratory is the subterm. Yeah, failure, respiration or respiratory. Okay, acute with hypoxia. Okay, with hypoxia, J96.01. Okay, so J96.01, that is acute hypoxic respiratory failure. Okay, acute hypoxic respiratory failure, the code is J96.01. Okay, J96.01. And so hypercapnic respiratory failure, J96.02. Okay, so hypoxic and hypercapnic, both respiratory failures are documented. So there is no specific combination code for hypoxic and hypercapnic respiratory failure. So that's the reason we can give hypercapnic respiratory failure separately. Okay, so acute hypercapnic respiratory failure. Okay, acute hypercapnic respiratory failure, the code is J96.02. Okay, for example, in the same example, the blood culture is positive for E. coli, for example. The blood culture is positive for E. coli. How to code this?
Sepsis due to E. coli.
The blood culture is positive for E. coli.
E. coli sepsis.
So that time we can give E. coli sepsis in place of unspecified. Okay, A41.9 unspecified place low, you can assign E. coli sepsis. Okay, so the E. coli sepsis A41.51.
A41.51.
So the code, yes. Okay, sepsis. Okay, E. coli. Okay, Escherichia coli. Sepsis, Escherichia coli, A41.51. Okay, so the A41.51. So the diagnosis code description is sepsis due to Escherichia coli. Okay, A41.51. So next. So in the same example, I delete secondary to sepsis. Okay, so in place of secondary to, just I changed. Okay, so end. Okay, so the patient admitted for acute hypoxic and hypercapnic respiratory failure and sepsis. The blood culture is positive for E. coli. Okay, so can you consider as severe sepsis in this example?
Yes, sir.
No.
No,
No,
sir.
we do not consider severe sepsis. Why? Why we do not consider as severe sepsis?
Patient should specify.
మనకి ఈ ఆర్గాన్
Related.
ఫెయిల్యూర్ కి ఓకే సో ద ఫిజిషియన్ ఈజ్ నాట్ డాక్యుమెంటెడ్ లైక్ ద ఆర్గాన్ ఫెయిల్యూర్ కాజ్ ఈజ్ సెప్సిస్ ఓకే అంటే మనకి సెప్సిస్ వాట్ ఈజ్ సెప్సిస్ ద సెప్సిస్ ఈజ్ బ్లడ్ ఇన్ఫెక్షన్ ద ఇన్ఫెక్టెడ్ బ్లడ్ ఈజ్ సర్క్యులేటెడ్ సమ్ ఆర్గాన్స్ so that time the infection is attacking the specific organ so that time the organ is not functioning properly so that time the organ is failed so that is called severe sepsis. Okay, so in this example, there is no documentation relationship between organ failure and sepsis. So that's the reason we do not consider as severe sepsis. Okay, any acute organ failure and sepsis is documented. By default, we do not consider as severe sepsis. So the physician must and should documented relationship between these two conditions. The organ failure is related to sepsis. So that time only we can consider as severe sepsis. Otherwise, we do not consider as severe sepsis. Clear?
Okay, sir. Clear.
Yes, sir.
Okay. So how is sepsis topic?
Very
Good,
interesting.
sir.
So
Yes.
so many okay, next in and so many guidelines like so I will show you some guidelines. Okay, sepsis with organ and the source of sepsis is due to non-infection condition. Okay, for example, now we are learning like this guideline like sepsis due to any localized infection. So the sepsis as the principal diagnosis and the localized infection are the secondary diagnosis. But the source of sepsis is due to non-infection condition. So that time the non-infection condition as the principal diagnosis and the sepsis as the secondary diagnosis. That is also another guideline. And sepsis due to, acute respiratory failure due to severe viral sepsis. So that time 4 codes required. So I will tell you in tomorrow class. Okay.
Okay,
So,
sir.
and sepsis and post-procedural sepsis. Okay. And sepsis with a non-infection condition like sepsis due to aspiration pneumonia, how to code, and sepsis and COVID-19, how to code, and sepsis due to gram-negative aspiration pneumonia, how to code, and post-procedural wound infection and post-procedural sepsis, how to code, and encephalopathy due to sepsis, how to code, and acute pyelonephritis due to sepsis and transplanted kidney, so how to code, and how many codes required, and severe sepsis due to VAP. VAP means ventilator associated pneumonia. How many codes required? So these are all very tricky. Okay, so sepsis due to multiple reasons. The underlying cause of sepsis is due to localized infection, and so non-localized infection, both conditions. So that time, how to select the principal diagnosis. So these are all very, very different topics. Okay, and bloodstream infection due to midline catheter. Okay, and dialysis central line. So the source of infection, the source of sepsis is due to dialysis central line catheter. So how to code. So we will discuss these are all one by one. Okay, so any questions regarding sepsis topic? So this is very complicated chapter, but this is very interesting. It is interesting or boring?
Interesting, very interesting.
Okay. So ఇన్ని రోజులు మీరు నేర్చుకున్న ICD గైడ్ లైన్స్ కి ఇప్పటికి వేరియేషన్ అర్థమవుతుందా మీకు? మీరు ఇంకా ఎంతగా నేర్చుకోవాలనేది?
Yes, sir.
ఓకే. సో మీకు ఇప్పుడు HCC 10 years ఎక్స్పీరియన్స్ ఉండొచ్చు, ED 10 years ఉండొచ్చు, ఓకే, ENM 10 years అబౌవ్ ఉండొచ్చు. బట్ సో ఇక్కడ ఈ ఐపీలో చేసేటంతగా మీరు ఇంత డెప్త్ గా ఆలోచించి అక్కడ ICD కోడింగ్ గైడ్ లైన్స్ అనేవి చేయరు. ఓకే, బట్ దిస్ ఈస్ ద పర్ఫెక్ట్ కోడింగ్. ఓకే, మనం అక్కడ కనిపించే కోడ్ చేసాం అన్నట్టు ఉంటుంది కానీ బట్ ఐపీలో అలా చూడకూడదు. ఓకే, చాలా చెక్ చేసి మనం కోడింగ్ చేయాల్సి ఉంటుంది. ఓకే, సో నెక్స్ట్, that's it guys. Okay, so tomorrow we will discuss sepsis topic. Okay, and so AIDS exam assessment.
Yes, sir.
Please complete that assessment. Okay, we will discuss that assessment by Saturday. Okay, so this Saturday we will discuss conventions and AIDS assessment. Okay.
Okay.
Okay guys, bye.
Okay, sir. Thank you.
ఇది PDF ఇస్తారా?
Yeah, sure.
Remotes.
I will share this PPT, no issue. Okay, so
Sir.
నేను ఈ PPT షేర్ చేస్తాను మీకు, అండ్ క్లాస్ రికార్డింగ్ కూడా షేర్ చేస్తాను. I will
Okay,
share this
sir.
PPT and class recording.
Sir, కూర్చునే డౌట్స్.
సేమ్ టైమింగ్ మార్నింగ్ ఏమన్నా ఉంటుందా సాటర్డే క్లాస్?
సారీ, నాతోనే మాట్లాడుతున్నారా?
అవును సంతోష్ గారు, సాటర్డే క్లాస్ వచ్చి సేమ్ టైమింగ్ లో ఉంటుందా?
Saturday,
morning time.
so same times. Okay, I have some other classes in Saturday morning, so Saturday also same times.
ఓకే.
సార్ ఒక డౌట్ ఉంది
Okay.
సార్.
Yeah, చెప్పండి.
క్లాస్ మధ్యలో మీరు ఇన్పేషెంట్ కోడింగ్ గైడెన్స్ న్యూమోనియాతో మనము న్యూమోనియా విత్ MRSA కోడ్ చేయకూడదు, పేషెంట్ స్పెసిఫిక్ చేయాలని చెప్పారు కదా సార్. లోకల్
అవును.
ఇన్ఫెక్షన్ కి
Yes.
బ్యాక్టీరియాని పేషెంట్ మెన్షన్ చేయాలని చెప్పారు కదా. ఆ లోకల్ ఇన్ఫెక్షన్ ఓన్లీ న్యూమోనియాకే సార్, లేదు వేరే లోకలైజ్ ఇన్ఫెక్షన్ కూడా చూడాలా? ఆ గైడ్లైన్ అప్లికబుల్ అవుతుందా?
సో నేను అక్కడ ఏం చెప్పాను, సో సెప్సిస్ అంటే ఏమనుకున్నా మనం, సిర్స్ డ్యూ టు ఎనీ లోకలైజ్డ్ ఇన్ఫెక్షన్, దట్ ఈస్ సెప్సిస్. ఓకే, యాజ్ పర్ గైడ్ లైన్, sepsis due to any localized infection, you can code the sepsis as the principal diagnosis and the localized infection as the secondary diagnosis, right? సో అయితే మనం ఎప్పుడైనా సెప్సిస్ కోడ్ చేసేటప్పుడు బ్లడ్ కల్చర్ లో ఏ ఆర్గానిజం అయితే మనకి గ్రో అయ్యి మనకి ఆ బ్లడ్ కల్చర్ లో పాజిటివ్ అని వస్తుందో, యూ కెన్ రిలేట్ దట్ ఆర్గానిజం టు సెప్సిస్. ఓకే, సో అంతేగాని మీకు ఇప్పుడు సో పేషెంట్ ఇప్పుడు సెప్సిస్ వచ్చాడు, సెప్సిస్ సోర్స్ న్యూమోనియా అని చెప్పాను, బట్ స్పోటమ్ కల్చర్ లో పాజిటివ్ ఫర్ ఎంఆర్ఎస్ఏ అంటే అప్పుడు మనం ఆ ఎంఆర్ఎస్ఏని న్యూమోనియాతో రిలేట్ చేయకూడదు, సెప్సిస్ తో కూడా రిలేట్ చేయకూడదు. యూ కెన్ కోడ్ ఆల్ కండిషన్స్ సపరేట్లీ.
ఓకే.
ఓకే, ఎనీ అదర్ క్వశ్చన్స్? Yeah, okay guys, bye.
థ్యాంక్ యూ.